Have you ever felt your doctor was looking at your birth year instead of your eyes? It is a heartbreaking reality I call the healthcare industry's worst-kept secret. If you are over 60, medical ageism is not just frustrating, it is dangerous. Today, as your friend and physician, I am exposing 5 brutal truths that could save your life. We are uncovering the shortcuts and economic calculations happening behind closed doors. You deserve premium care, and I am here to help you get it. Truth number 1. The mental shortcut. Now, my friends, let us look at the first ugly reality that happens the moment you walk into a clinic. Truth number 1 is what I call the mental shortcut. In many medical offices across America today, you are being judged before you even say hello. The very second a nurse or a doctor looks at your chart and sees a birth year from the 1950s or earlier, a switch flips in their brain. They do not see a person with a lifetime of wisdom. Instead, they see a high-maintenance file. They see someone who will likely take up too much time, require mountains of Medicare paperwork, and have a list of health issues as long as a Sunday grocery list. This is a systemic bias that treats our elders like a burden on the clock rather than a patient in need. This happens because of what we call efficiency protocols in the modern American hospital system. Doctors today are under immense pressure from insurance companies and hospital boards to see as many patients as possible. They are often forced to work on a productivity clock. When they see a younger patient, they think it will be a quick 5-minute visit for a sore throat. But when they see you, they assume it will be a complicated 60-minute ordeal. This creates a hidden resentment. It is not always malicious, but it is deeply ingrained. Doctors are trained to assess resource intensity, and sadly, being over 60 puts you at the top of their list for being resource-heavy. This mental shortcut often leads to a phenomenon where the doctor already has their hand on the door handle before you have even finished explaining how you feel. The core reason why this is so dangerous is that as we age, our bodies become more intricate. A simple pain in the leg for a 20-year-old is usually just a strain. But for us, it could be circulation issues, nerve damage, or a side effect from a blood pressure medication. Doctors know this, and frankly, some would rather not dig into that rabbit hole. They fear that if they listen too closely, they will find 5 more problems they do not have the time to solve in a 15-minute time slot. This complexity aversion means they stay on the surface. They treat the symptoms they can see easily and ignore the deeper, more important signs that your body is sending out. You might recognize this in your own life through very specific symptoms of a bad doctor visit. Have you ever felt that the doctor was talking over you? Or perhaps you noticed they spent the entire visit looking at a computer screen instead of your face. You might leave the office feeling unheard, or worse, feeling like you are a nuisance for asking questions. This is not just in your head. Research shows that physicians spend about 23% less time actively listening to patients over 65 compared to younger adults with the exact same symptoms. When a doctor stops listening, they stop diagnosing. They start guessing. I remember a patient of mine named Margaret. She is a 74-year-old retired librarian from Ohio. Margaret is sharp as a tack and knows her body well. She went to see a new specialist because she was feeling a strange fluttering in her chest. She had even kept a neat little diary of when it happened. But the doctor barely looked at her. He saw her age, saw that she was on a couple of standard medications, and immediately told her it was just anxiety. He told her she was probably just stressed about getting older. Margaret tried to show him her notes, but he brushed them aside and said, "Let us just focus on the main concern today." He gave her a prescription for a mild sedative and sent her home. 6 months later, it turned out Margaret did not have anxiety. She had a heart valve issue that required surgery. Because that doctor used a mental shortcut, she spent half a year at risk of a major cardiac event. This is why you must stop being a passive participant in the exam room. If you feel dismissed, you must take control of the conversation immediately. Do not let them treat you like a number on a spreadsheet. Your health is too important to be sacrificed for the sake of a hospital's time quota. You are a paying customer and a human being who deserves the full attention of the person you are paying to help you. The best way to fix this is to show up prepared in a way that brings them to see you as an active partner. I want you to start bringing a one-page health summary to every single appointment. Do not bring a thick folder of papers that they will never read. Bring one single sheet of paper. In this paper, list your current medications, your major past surgeries, and most importantly, your specific health goals for the day. This simple piece of paper tells the doctor that you are organized, you are serious, and you are not going to be a passive observer. It breaks their mental shortcut because it shows you are a goal-oriented patient. When you speak to the doctor, use very specific and measurable language. Instead of saying, "I have been feeling a bit tired lately," try saying something like this: "Doctor, my energy levels have decreased by 40% over the last 3 months, and I want to identify the cause so I can get back to my daily 2-mile walk." Do you see the difference? By mentioning that 2-mile walk, you are telling the doctor that you are active and you have a baseline for your health. You are giving them a target to hit. This transforms you from a complicated senior into a person with a clear objective. It forces the doctor to shift their brain from management mode into problem-solving mode. Before we move on to the next point, I want to hear from you. Have you ever felt like a doctor was just trying to get out of the room as fast as possible? If you believe your time and your health have real value, I want you to go to the comments right now and type the word value in all capital letters. Let us show the medical establishment that we know our worth. Now, let us look at the next brutal truth about how they view your symptoms. Truth number 2, medical gaslighting. Now, let us move on to the second brutal reality, which is a very subtle form of discrimination I call medical gaslighting. This is when a healthcare professional uses your age as a convenient excuse to stop looking for the real cause of your pain. You have probably heard the phrase, "Well, you are just getting older," or "What do you expect at your age?" My friends, this is not a medical diagnosis. It is a socially acceptable way for a doctor to ignore your symptoms. When a doctor attributes legitimate physical distress to normal aging, they are practicing a form of neglect that can lead to devastating results. Dr. Michael Torres, a renowned geriatrician who has fought against ageism his entire career, explains that the phrase, "You are getting older," has become the ultimate medical cop-out. It is used to dismiss symptoms that would trigger an immediate and thorough investigation in a younger patient. This is not evidence-based medicine. It is an age-based assumption that can cost you your life. Statistics from the American Geriatric Society reveal a shocking truth. They found that 85% of serious conditions in seniors are initially attributed to aging before they ever receive a proper diagnosis. This means that heart disease is often ignored as simple fatigue, and cancer symptoms are brushed off as just normal wear and tear on the body. The biological reality is that while our bodies do change, aging is a slow and gradual process. Real medical issues usually present as a sudden shift in how you feel. Why this becomes so dangerous for us is that as we age, our systemic reserves are lower. Our bodies do not absorb nutrients like vitamin B12 as efficiently as they used to, and our cells do not repair themselves as quickly. However, this does not mean we should live in constant pain or exhaustion. When a doctor tells you that your brain fog or your aching knees are just part of the package deal of being over 60, they are ignoring the fact that these could be signs of inflammation, nutritional deficiencies, or even chronic autoimmune disorders. You might be experiencing these symptoms right now. Perhaps you feel a level of exhaustion that makes it hard to enjoy your morning walk, or maybe your joints are so stiff that you struggle to get out of your favorite chair. If your doctor tells you this is normal, you must question them. Normal aging does not happen overnight. If your symptoms appeared over a few weeks or months, that is not aging. That is a medical event that requires an investigation. Do not let them make you doubt your own intuition about your body. I want to tell you about Robert. He is a 67-year-old former construction supervisor from Chicago. Robert is a tough man who has spent his life on his feet. For about 8 months, he felt increasing stiffness in his joints and a level of fatigue that he just could not shake. Every time he went to his family doctor, he got the same answer. "Robert, you are not 30 anymore. Your body is just slowing down. Take some ibuprofen and rest." But Robert knew something was wrong. He finally demanded a full blood panel and went to see a specialist. They discovered that Robert had severe rheumatoid arthritis. Because of those 8 months of being dismissed, he suffered permanent damage to his finger joints that could have been avoided with early treatment. This is why you must take action. I want you to stop accepting age as a reason for your symptoms. The first thing you should do is create a very clear symptom timeline. Document exactly when your symptoms started and how they have changed. Bring this to your next appointment. If a doctor says that it is normal for your age, I want you to look them in the eye and ask this specific question. "Doctor, what tests would you order if I were 40 years old and standing here with these same symptoms?" This forces the healthcare provider to justify their decision. It makes them realize they are using a double standard based on their birth year. You should also remember that the food you eat plays a massive role in how you feel. While the medical system might give up on you, you should never give up on yourself. Proper nutrition can often reverse some of the symptoms that doctors call aging. However, because our bodies do not absorb nutrients as well as they once did, you must be more intentional about getting high-quality proteins and minerals from whole foods. Before we go further, have you ever heard a doctor use your age as an excuse? If you have been told it is just part of getting older, please comment yes below. It is time we stand together and demand better. Now, let us look at the third truth about what they really think of your mind. Truth number 3, cognitive prejudice. Folks, let us talk about something that really gets under my skin. It is the insulting assumption that because you have gray hair, you must have a gray mind. Truth number 3 is what I call cognitive prejudice. You might have noticed your doctor speaking a bit slower to you, or using very simple words as if they were talking to a toddler. This is actually a documented phenomenon called elder speak. Many healthcare providers treat seniors as if they are mentally fragile or incapable of understanding complex information. They simplify your treatment plans, not because the medicine is too hard, but because they believe you simply cannot handle it. Dr. Amanda Richardson, a leading neuropsychologist who studies medical bias, has revealed a shocking reality. She found that healthcare providers consistently underestimate the mental capacity of patients over the age of 65. They assume you cannot manage a complicated medication schedule or understand a new medical technology. This is not just annoying. It is a massive barrier to receiving the best possible care. When a doctor decides for you that a treatment is too complicated, they are effectively taking away your right to choose the most effective path for your health. The core biological reason behind this bias is a complete misunderstanding of how our brains actually age. While our processing speed might naturally slow down a tiny bit as we get older, our crystallized intelligence, which is the accumulation of wisdom, knowledge, and experience, actually stays very strong. In many cases, it even improves. But doctors often mistake a thoughtful, measured pause for confusion. They think that because you are not answering as fast as a 20-year-old, you are not following the conversation. This leads to the simplified treatment trap, where you are given the easiest option instead of the best option. You might be experiencing the symptoms of this prejudice right now. Have you ever felt patronized during a checkup? Do you find that your doctor skips over the technical details of your diagnosis, thinking you will not get it anyway? Or perhaps you have noticed they direct their questions to your adult children instead of looking you in the eye. These are signs that your doctor has already decided you are mentally checked out. This makes it impossible for you to provide informed consent for your own surgeries or medications. Scientific research shows that seniors are far less likely to be offered participation in cutting-edge clinical trials. Doctors often decide for you that a trial is too much work for your mind to handle. Let me tell you about Eleanor. She is a 71-year-old retired chemistry professor. Eleanor spent her entire life in a laboratory. When she was diagnosed with early-stage breast cancer, her oncologist immediately recommended a very basic surgery. He did not discuss reconstruction options, nor did he mention the latest targeted therapies or local trials. He told her, "At your age, we want to keep things straightforward." Eleanor was stunned. She understood the molecular biology of her cancer better than the doctor did. She had to spend weeks fighting the system just to be treated like the intelligent professional she is. You must shatter these assumptions the moment you sit down. Do not wait for the doctor to treat you with respect. You have to demand it through your actions. I want you to take corrective action. Stop being polite when they talk down to you. Instead, take a constructive action. Start the conversation by stating your professional background or your educational history. You could say, "Doctor, I spent 40 years as a project manager, so please give me the full technical details of my options so I can make an informed decision." You should also use your technology as a shield. Open your health app on your smartphone or reference a recent medical study you found on your tablet. When they see you are tech-savvy and informed, their bias often evaporates. We should also remember that while a healthy diet supports the brain, showing that you are mentally active is your best defense in a clinical setting. The practical solution is simple. Ask for the pathophysiology of your condition. Ask about the underlying mechanisms of the drugs they suggest. When you use their own medical language, they are forced to treat you as an intellectual equal. You are not a child. You are a person with a lifetime of expertise, and it is time your doctor recognized that your mind is as sharp as ever. Truth number 4. Medication as behavioral control. My dear friends, we have arrived at a very dark reality I call chemical restraint. In many busy hospitals and care facilities across America, medications are not always used to heal the body. Sometimes they are used to quiet your voice. If you ask too many questions or show frustration, some providers find it easier to medicate you into a state of compliance. Dr. James Martinez, a former medical director, reveals that psychiatric drugs are frequently prescribed to seniors without any mental health diagnosis. He calls this administrative convenience. It is a way to reduce the workload of the staff by ensuring patients are too drowsy to complain. Biologically, our aging liver and kidneys do not clear medications as quickly as they once did. This causes powerful drugs to build up to toxic levels in our bloodstream. What is a standard dose for a young person can become a life-threatening overdose for a 70-year-old. You might feel sudden confusion, heavy limbs, or a loss of balance. Far too often, doctors see these signs and assume you have dementia. But I am here to tell you, it is often not dementia at all. It is the medication stealing your mind. Scientific research shows that 40% of seniors are on psychiatric drugs, yet only 12% actually need them. These pills significantly increase your risk of a fatal fall and can even double your risk of mortality. Think of Martha, a 69-year-old retired teacher. After hip surgery, she asked the nurses many questions about her recovery. The staff labeled her difficult and gave her a sedative to help her settle down. That night, Martha woke up dizzy, fell, and broke her wrist. Her recovery turned into a nightmare because the hospital wanted her quiet. Before reaching for a pill, look at your nutrition. Foods like spinach and almonds are rich in magnesium, which naturally calms the nervous system without the risk of a fall. Real food is your first line of defense. You must take action now. If a doctor suggests a mood pill, stop and ask, exactly what medical condition is this treating? What is the plan to stop taking it? Request a full medication review every 6 months. If you want a clear mind and an honest medical record, comment the word "clean" below. You are a person with a beautiful personality, not a patient to be managed. Truth number 5, the life value calculation. Now we come to the final and perhaps most cold-hearted truth of all. Truth number 5 is the life value calculation. It is a heartbreaking reality where the medical system implicitly decides that your life is worth less simply because you have already lived more of it. Behind closed doors, insurance companies and healthcare systems use a mathematical formula called QALY. That stands for Quality Adjusted Life Years. Essentially, they weigh the cost of a treatment against the number of years they expect you to have left. If a procedure is expensive and you are over 70, the system often decides the return on investment is not high enough. This is not medical science. This is actuarial discrimination disguised as common sense. Dr. Patricia Chen, a professor of medical ethics, has spent years exposing how these calculations influence which surgeries are approved and which clinical trials are funded. She explains that a 40-year-old is often prioritized over an 80-year-old, even if the 80-year-old is in better overall health. The core reason the system does this is purely economic. They view the remaining years of a senior as a diminishing asset. But this logic ignores the biological reality that many seniors today are living active, productive lives well into their 90s. Your value as a human being does not decrease with every candle on your birthday cake. You might recognize the symptoms of this valuation at your next specialist visit. Perhaps you are being discouraged from a knee replacement or a heart procedure because the doctor says it is too aggressive for someone your age. They might frame it as a concern for your comfort, but often it is a concern for the hospital budget. You might feel like you are being steered toward hospice or palliative care when you still have plenty of fight left in you. Scientific research in medical journals shows that seniors are often denied life-saving interventions simply because they have passed a certain age threshold on a chart. Let us look at Arthur. He is a 68-year-old retired engineer from Virginia. When Arthur was diagnosed with kidney failure, his primary doctor suggested he consider comfort care instead of starting dialysis. The doctor implied that at his age, the toll of the treatment might not be worth it. Arthur felt like he was being told to go home and wait to die, but Arthur knew he had more life to live. He took corrective action. He stopped listening to that first doctor. He took a constructive action and sought a second opinion from a geriatric specialist who saw Arthur as a person, not a set of statistics. Arthur started dialysis, eventually qualified for a transplant, and has lived 7 wonderful years since that first conversation. He spent those years traveling and watching his grandkids grow up. You must be your own advocate. Do not accept comfort care if you want a cure. Always mention your rights under Medicare. It is a federal program designed to ensure you get the care you paid for throughout your working life. Demand to know if a treatment is being denied based on age or based on medical necessity. Ask the doctor, would you say the same thing if I were 40 years old? This forces them to confront their own bias. Seek out geriatric specialists who understand that 70 is the new 50. Your life is priceless, and no formula in a boardroom should ever be allowed to tell you otherwise. My friends, you now hold the power to change your healthcare journey forever. Remember, you are not just a number or a birth year on a chart. You are a person with a story that deserves to be heard. Knowledge is your greatest defense against ageism. In the comments below, please share one small promise you are making to yourself today. Will you bring a health summary to your next visit? Like, subscribe, and share this with a friend. Together, we can demand better care.